Hi guys, welcome to Pills and Things, where today we will be talking about how to lower blood pressure. But first, just to get some background and context, we have to answer the question of why is high blood pressure bad? If your blood pressure stays too high for too long, it can start damaging your organs such as your heart, kidneys, brain, and eyes. And high blood pressure can increase your risk for heart attacks, strokes, heart failure, kidney damage and or kidney disease, aneurysms, memory trouble, and vision loss, just to name a few. There's a reason why high blood pressure is often called the silent killer, and that's because people often don't have symptoms until there is already damage being done to the body, which is why it's very important to monitor your blood pressure. This begs the question, what blood pressure is too high? And there's not a clear answer here, as it depends on a lot of different factors such as your age, family history, and other health conditions that you may have. Generally speaking, the American Heart Association recommends a blood pressure of less than 120 over 80, but it's technically not considered high blood pressure, also known as hypertension, until you are over 130 over 80. Your doctor may have a different goal for you based on your specific situation, so try to find out your personal blood pressure goal from your doctor. When high blood pressure gets very serious is if the top number, also known as systolic blood pressure, gets over 180, or if the bottom number, also known as diastolic blood pressure, gets over 120. This is considered hypertensive crisis and usually requires contacting your doctor immediately or going to the hospital, depending on what symptoms you're experiencing and your specific situation. This will be a topic for a future video, so I won't touch on it too much here. Now that we know the dangers of high blood pressure and some general blood pressure goals, how can we lower blood pressure? Number one on the list would be to eat a healthy diet that is low in salt, also known as sodium chloride. The 2020 to 2025 dietary guidelines for Americans recommend that we consume less than 2,300 milligrams of sodium each day, but your doctor may have a different goal for you. Keep in mind there is already a lot of sodium in much of the foods that we eat, especially processed foods and foods from restaurants, so simply eliminating the salt shaker is not enough. It's important to also read your food labels. As far as eating a healthy diet, eating foods high in fiber and low in fat and carbs is generally recommended, but talk to a dietitian for more information. Second on the list would be keeping your stress under control. Stress can raise your blood pressure, so it's very important to find ways to manage your stress. This is a whole topic in of itself that I will probably cover in a future video, but just a few quick tips would be to exercise more, identify and try to avoid things that trigger your stress if possible, limit stimulants like nicotine and caffeine, have realistic expectations for yourself and others, and look into relaxation techniques such as breathing exercises. Speaking to a therapist or a counselor might also be a good idea. Next is something we touched on already, which is regular exercise. Regular exercise is not only a great stress reliever, but it can help lower blood pressure. The ideal goal is 150 minutes per week of moderate exercise, but ease into it and try to do something you enjoy doing. Fourth is quit smoking if you smoke. Nicotine in tobacco products is a stimulant and can increase blood pressure as well as contribute to several other risks. If you currently smoke or use tobacco products, you may want to consider quitting if you haven't thought about it already. It's not easy, but definitely worth it. This will also be a topic I will discuss in a future video. Next would be to maintain a healthy weight. Naturally, this infers losing weight if you are overweight, which is a very sensitive subject. There are many different ways to lose weight, and I'm sure you can find all sorts of YouTube videos on this topic, but most approaches involve eating healthy and physical activity. My main tip here would be to set realistic goals with a realistic time frame to reach them and reassess your progress periodically. Remember, slow and steady wins the race. Again, this is easier said than done, but weight loss helps with several health conditions, high blood pressure being just one of them. Number 6 on the list is avoid drinking too much alcohol. The 2020 to 2025 Dietary Guidelines for Americans defines this as drinking more than 2 drinks per day for men or 1 drink per day for women. And an alcoholic drink is defined as 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of hard liquor. Number 7, avoid medications and supplements that can raise blood pressure. You may want to talk to your local pharmacist for questions regarding your specific medications or supplements, but some common medications that can raise blood pressure are pseudoephedrine, also known as Sudafed, ibuprofen, also known as Advil or Motrin, naproxen, also known as Aleve, Adderall, and Ritalin, just to name a few. A couple supplements that may also raise blood pressure to watch out for are ephedra, licorice, and ginseng. As a side note, if you happen to partake in cocaine or methamphetamine, they will also raise your blood pressure. Number 8, pain can sometimes spike your blood pressure, so work with your doctor to keep your pain under control. Number 9, make sure to work with your doctor to manage any other health conditions that you may have that can also worsen high blood pressure. Some examples are sleep apnea, kidney disease, thyroid problems, diabetes, tumors that affect the adrenal gland, and more. Last, if your blood pressure is still high while doing all these things, your doctor may prescribe blood pressure medications, which is something I will cover in a future video as it's a very large topic. Alright, so if you learned something today or found value from this video, make sure to hit that like button. If you want more easy to understand content on health and medicine, make sure to subscribe to the channel. And last thing, this video is for educational use only. This video is accurate to the best of my knowledge as of the date posted, but data is always changing, so always consult your doctor and pharmacist regarding your medications and what would be best to do in your specific situation. Thank you for your time and stay healthy. See you next time.